the ligaments around the area where you're having the where you're having that tightness, where there's a lack of flexibility there. If you imagine, if you have kind of I don't know, if you have a shirt which is or a top which is made out of lycra, it's really stretchy. It has that flexibility in it. If you rip it and then you sew it up with something really non-flexible, just like a really thick cotton wire or cotton thread, if you sew it back together, when you stretch it, you'll know that all the area around that around where you've sewn it up, that's going to pull more than the rest of it. And effectively that's what happens when you have a sprain. You have scar tissue that's formed within the ligament, which is usually a flexible structure, and it's been patched up by scar tissue. And when that scar tissue is patched up, that creates that kind of lack of flexibility around that area, and it causes extra stress around the joint, around the sides of the scar tissue. So the normal or the healthy tissue around the scar tissue is more prone to get injured. But in your case, you don't just have that. You also have a lot of tightness in all of the muscles going up the leg. So you've got a lot of tightness in those tissues. Now, when you have tightness in those tissues, it means that because of the lack of flexibility you have in the muscles, you're going to cause more stress in and around the area where the scar is. So you're much more likely to damage it again. So in terms of treating you, we need to help you try to get all the flexibility back in your lower leg. So in all of the muscles, and it's not uncommon for people who've had an ankle sprain to have this type of inflexibility within the muscles, because what you naturally do, and you're told to rest and not to move and to avoid activity and not to walk on the leg. So naturally all the muscles around that area will start to get tight. So first of all, we want to take off a lot of stress from the ligaments and the ankle joint, first of all, by getting the flexibility back in the muscles, because if they don't stretch when you move, the ankle is going to need to stretch, and if the ankle stretches, the ankle is more likely to rip again, especially if there's a lot of scar tissue buildup. So the first part of one of the most important things is getting that flexibility back. So that's why we're going to give you those stretches for the legs. And then the second part is to try and get rid of that scar tissue and encourage new and healthy tissue to grow back. So for example, if you're a runner, you're running all the time, you wouldn't be able to put up with this type of injury. You'd need to get that scar tissue back to normal tissue. So this is what we're going to try and do by working kind of either once or twice a week, depending on the frequency that we can arrange on that scar tissue. We'll break it down and we'll get it to recover as new tissue and ligamentous tissue, specialized tissue, which is more elastic. So this is what we're hoping to do over the period. The final thing is the feedback from the ligaments needs to be returned. So I'm going to give you some exercises which are proprioceptive exercises, which are basically exercises which rely on that feedback. So the more you rely on that feedback, the more your tissues will grow. Okay, so we have here what we can see quite clearly. When I compare the two sides, we can see on the medial side, and this is one of the more rarer sprains where there's been damage to the ligaments on the medial side of the ankle. The patient has had previous sprains on the lateral ankle, however the most recent one has been on the medial ankle, and this can happen when we get more rigidity developing in the kind of the lateral ligaments. We have more movement then occurring in the medial ligaments, so again this area can also become sprained. Like I said, it's one of the rarest sprains, but it can happen especially during football. So the technique that we're going to be using works on a simple principle of trying to break down scar tissue. Now when I say that actually does involve tissue damage. So we're going to pop a little bit of, this is just cocoa butter I'm using, and this is the instrument, the soft tissue mobilization instrument. Now what we do is we just use this and just gently kind of scrape upon the tissue. Now what I get to feel when I'm using this is I feel that there's a very kind of thick and dense grainy tissue right over where that scar has developed. If I can just get you to turn slightly to the side for me, just turn the leg up a little bit, that's it, perfect. Okay, and what I'm going to do here, we'll see if we can demonstrate that, but I'm not sure if you're able to kind of see in from there. But we're just going to gently rub using this instrument to try and kind of target that tissue. Now when we're using this technique, the harder grainy tissue will take more of the force when we're rubbing over, and the more soft and elastic tissue will begin to move away, and it won't take as much of the force because it has that give in it. So what we're doing here is we're causing kind of controlled micro trauma to the scar tissue to slowly start to break it down. Does that feel okay? Yeah. Okay, so when we use this technique, we're trying to break down that scar tissue, and after having this done, it doesn't usually feel too uncomfortable. It's like I said, it's controlled micro trauma, so it's tissue damage that we're trying to encourage. It's normal to have quite a bit of redness in and around the area, which we can see is kind of starting to develop a little bit. But when we do this consistently, we have breakdown of the scar tissue, and we get the patient then to work on mobilization exercises, stretching the area and stretching the ligaments gently to try and encourage remodeling of those ligament tissues, because when we have tissue damage, we get tissue repair. And when the tissue starts repairing, if you're stimulating it well enough, you can stimulate the tissue to lay down the type of tissue that you want. So if we're constantly stretching the area, there'll be more elastin laid down, and there'll be more kind of flexible tissue in that ligament. When we do this repeatedly over a course of treatment, we gradually start seeing some changes in the tissue, and we see the scar tissue begin to kind of disappear, and we have more natural ligamentous, specialized ligamentous tissue that regenerates in the area. We also work a lot on proprioception and getting the patient to do proprioceptive exercises, because these ligaments contain lots of sensors which tell your body where you are. Because when we're walking around, we don't look at our feet. We have sensors in our ligaments which tell our body where our feet are, where our position is in space, so that when you step on something which is slightly uneven, your body knows you've stepped on something uneven and it adjusts. Whereas without having that proprioception, you'd have to constantly look at your feet to know where they are in space and where the position is.